Hello everyone, welcome back to KS Medical Coding Academy. In this lesson, we will learn about office or other outpatient evaluation and management services. This is one of the most important topics for the CPC exam and everyday physician coding. We'll discuss patient types, code selection, medical decision-making, total time, documentation requirements, and practical coding examples to help you confidently assign outpatient EM codes. Before we begin, this training is for educational purposes only. Always refer to the latest CPT, ICD-10CM, HCPCS Level 2 manuals, payer policies, and official coding guidelines when assigning medical codes. In this lesson, we'll begin by understanding what office or other outpatient evaluation and management services are. Next, we'll learn how to distinguish between new and established patients and identify the correct patient visit type. We'll then review the outpatient EM coding guidelines and learn how to select the appropriate level of service based on either total time or medical decision-making. Finally, we'll reinforce these concepts with practical examples and a knowledge check to strengthen your understanding. Office or other outpatient evaluation and management services are provided to patients who visit a physician or qualified healthcare professional in an outpatient setting. These patients receive evaluation, diagnosis, or treatment but do not require admission to the hospital or an overnight stay. These services are reported using Captain codes 99202 through 99215. Office or other outpatient EM services can be performed in several healthcare settings. These include telehealth services with place of service 02, a physician's office with place of service 11, an urgent care facility with place of service 20, an outpatient hospital with place of service 22, and an ambulatory surgical center with place of service 24. Understanding the correct place of service helps ensure accurate medical coding and billing. Before selecting an office or outpatient EM code, the first step is to determine whether the patient is new or established. This decision is based on the patient's previous billing history, prior visits, the provider's specialty, and when the patient last received professional services. A patient is classified as a new patient if there are no previous visits on record, if the last professional service was provided more than 3 years ago, or if the patient is now being seen by a physician of a different specialty within the same organization. An established patient is someone who has received professional services from the same physician, or another physician of the same specialty within the same group practice, during the past 3 years. These patients are reported using established patient EM codes. To correctly classify a patient, first review the billing history and previous visits. Next, determine whether the last professional service occurred within the past 3 years. Finally, verify whether the physician belongs to the same specialty or a different specialty. Following this process helps ensure accurate selection of outpatient EM codes. A medical specialty is a specific area of medical practice in which physicians receive advanced training and provide specialized care. Each specialty focuses on particular diseases, body systems, patient populations, or procedures. Examples include cardiology, neurology, orthopedics, gynecology, and anesthesiology. A subspecialty is a more focused area within a primary medical specialty. Physicians complete additional training to develop expertise in a specific field. For example, pain management is a subspecialty of anesthesiology, while child psychiatry is a subspecialty of psychiatry. When determining whether a patient is new or established, it is important to verify the physician's registered specialty. This information can be found in the National Provider Identifier, or NPI, registry. Checking the provider's taxonomy helps ensure the correct patient classification and accurate EM code selection. A new patient is someone who has not received any professional services from the same physician or another physician of the same specialty in the same group practice within the previous 3 years. Visits after more than 3 years or visits to a different specialty physician are generally considered new patient encounters. An established patient is one who has received professional services from the same physician, or another physician of the same specialty within the same group practice, during the past 3 years. Most follow-up visits are reported using established patient EM codes. Office visit coding consists of three major areas. First, identify the type of care provided. Second, determine the EM level using medical decision-making or time. Finally, consider whether any additional preventive, diagnostic, or procedural services were performed during the visit. The first step in selecting an office visit code is identifying whether the patient is new or established. New patient visits are reported using Captain codes 99202 through 99205. Established patient visits use codes 99211 through 99215 depending on the level of service. Once the patient type is identified, the EM level is selected using either medical decision-making or total time, according to Captain guidelines. The provider may use whichever method is appropriate for the documented encounter. Medical decision-making is divided into 4 levels: straightforward, low, moderate, and high. The level depends on the complexity of the patient's problems, the amount of data reviewed, and the overall risk involved in patient management. When selecting an office visit based on total time, determine whether prolonged services apply. Prolonged service reporting differs between Medicare and non-Medicare payers, so always follow the appropriate payer guidelines. During an office visit, providers may perform additional services such as preventive care, diagnostic testing, or procedures. These services may be reported separately when Captain guidelines allow and documentation supports separate billing. Office and other outpatient EM services are selected based on whether the patient is new or established. The provider may choose the level using medical decision-making or total time. Additional prolonged service codes may be reported when supported by documentation. For new patients, Captain codes 99202 through 99205 are selected according to the complexity of medical decision-making. As MDM complexity increases, the EM code level also increases. When coding by time for new patients, use the documented total time spent on the encounter. If the total time is less than 15 minutes, the provider should select the code based on medical decision-making. For established patients, Captain codes 99212 through 99215 are based on medical decision-making. Code 99211 is unique because it may be reported without the presence of a physician or qualified healthcare professional. Time-based coding is also available for established patients. The total physician or qualified healthcare professional time determines the appropriate Captain code. If the visit is less than 10 minutes, use medical decision-making. For Medicare patients, prolonged office and outpatient EM services are reported using HCPCS code G2212, not Captain code 99417. G2212 is reported only after selecting the highest level office visit code, either 99205 for new patients or 99215 for established patients, and only when the physician's documented total time exceeds the CMS threshold. Each additional qualifying time interval may be reported with 1 unit of G2212, following current CMS guidelines and documentation requirements. For non-Medicare payers, prolonged office visit services are typically reported using Captain code 99417 when the required additional time is documented and payer guidelines allow. Office and other outpatient EM services require a medically appropriate history and physical examination. However, unlike previous EM guidelines, history and examination alone do not determine the code level. The final office visit code is selected using either medical decision-making or total time. CPT code 99417 is used to report prolonged office or outpatient EM services. It includes the physician's total time on the date of the encounter, including both face-to-face and certain non-face-to-face activities. It is reported only with the highest level office visit codes, 99205 and 99215. CPT code 99417 may only be reported when the office visit level is selected using total time. The provider must first report the highest level office visit code, either 99205 or 99215, and documentation must support the additional prolonged time. To report 1 unit of CPT 99417, at least 15 full additional minutes beyond the required threshold must be documented. If the additional time is less than 15 minutes, CPT 99417 should not be reported. Always verify payer-specific requirements before billing prolonged services. CPT code 99417 is used only when the physician's total time exceeds the highest office visit code threshold. Do not report 99,417 with CPT 99,205 if the total time is less than 75 minutes, or with CPT 99,215 if the total time is less than 55 minutes. For Medicare patients, HCPCS code G2212 has different reporting thresholds than CPT 99417. Do not report G2212 with CPT 99205 unless the total time is at least 89 minutes, and do not report it with CPT 99215 unless the total time is at least 69 minutes. A shared or split visit occurs when a physician and another qualified healthcare professional both participate in providing services for the same patient encounter. Their work may include face-to-face and non-face-to-face activities performed on the date of the visit. When calculating total time for a shared or split visit, only distinct time should be counted. If two providers spend time together with the patient, that overlapping time is counted only once. Only separate, non-overlapping time may be added together to determine the total encounter time. Let's review this coding scenario. A 50-year-old established patient returns for a follow-up office visit for pain management. During the visit, the physician reassesses the patient's condition, provides counseling, reviews additional history from the patient's husband, discusses treatment compliance, prescribes physical therapy and Toradol, and documents a total physician time of 25 minutes. The medical decision-making is documented as moderate. The correct captain code is 99,214. This is an established patient office visit with moderate medical decision-making. Although total time is documented, the moderate MDM supports reporting captain code 99214. Both time and medical decision-making are documented in this case. Based on total time of 25 minutes, the visit would qualify for CPT 99,213. However, the documented medical decision-making is moderate, which supports CPT 99,214. According to Captain Office and Outpatient EM guidelines, the provider may select the code based on either total time or medical decision-making. Therefore, the correct code is 99,214. Congratulations! In this lesson, we covered the fundamentals of office and other outpatient EM coding, including patient status, medical decision-making, total time, prolonged services, and coding guidelines. These concepts are essential for accurate captain coding and CPC exam preparation. Thank you for joining this lesson from KS Medical Coding Academy. We hope this session helped strengthen your understanding of office and other outpatient EM coding. We look forward to learning with you again in the next lesson.